been, oops, got it. All right. My experience has been, let me see, probably 35 to 40 years ago, I started as a childbirth educator. From there, I became a nurse. I was a postpartum nurse, and then I was a labor and delivery nurse. Meanwhile, I was having babies, and I had had midwifery births in a midwifery birth in another country. So I was discovering about midwifery in this country. I worked with a local midwife when she started her own birth center. And then in my midwifery training, I did some training in the hospital, but most of it in the community. And when I decided to work myself, I decided that the community was the place for me, and I've done that ever since. When I started with birth center, I'm sorry it's going on a bit, but let's just, all right, there's not many of us. So when I started my own birth center, I felt like it was very important to not just be a boutique kind of community provider, because people who want birth center or home births have over time been thought of as paying out of pocket and willing to pay a lot. But of course, the majority of people can't do that. So we have to be able to reach them. If you believe in that kind of care, you've got to be in network, and you've also got to be in network for Medicaid. And as I was the only provider doing Medicaid as a birth center, it became a much different kind of birth center practice from most of them. I'd say, more diverse. And then, anyway, what I'm talking about with maternal mortality and morbidity is I come to believe I'm a little bit of a, what's the word? Evangelist for community midwifery. And I don't apologize for that, because I can't escape it. But I do believe that the countries, I know we're doing a lot of comparing between different states, but the countries with better outcomes, which are most of them, in fact, all of them, who are talking of the wealthier nations, midwifery is the primary care model for healthy pregnancy. And I feel like it's such an unrecognized force. And then, of course, in the community as well, that that's kind of my whole cause, in addition to improving the care specifically for Medicaid people, not to say that which overlaps with the equity and diversity piece, but obviously not imperfectly, because it's not the same thing.
Thank you, Donna. We're going to move on and let some others
introduce
themselves. That's all right. That's all right. Brianna, you're next.
Your audio.
I forgot about it. No, I'm the founder of Let's Talk PPC, and been doing this for about 5 years now, just with patient advocacy. Right now, because I know I've done spoken in the past about what we're doing to raise awareness. So now we're partnering with healthcare providers and birth workers that we're hosting PPCM workshops for them to be able to educate them a little bit more on, how they can better save mothers' lives and to treat the condition, because some doctors are still learning about how to actually, prevent heart failure from happening. So, because a woman is not diagnosed with PPCM until she's actually in heart failure. So we had created a screening tool this year that we have been helping with the doctors, trying to get them to understand the screening. It's like a 10-question screening, and It basically is proven the fact that if a mother was recommended to get a BNP blood test, then she would have known that she was going into heart failure. Um, and we've done had about 200 PPCM survivors who've actually been studied for it. So that is currently where we at with that. But other than that, yes, I'm still going strong with awareness.
Well, you've come a long way since we first met. Has it been 5 years ago that we met at the Aphia Center?
I don't think it's quite that long.
Oh, well, I'm impressed with what you've accomplished.
Yeah.
I believe that probably 4 years. Yeah, it was like 3 years
Oh,
ago.
wow. Okay. Well, now we'll move on to Kiana.
Thank you.
Hey y'all, I got on just a few minutes late, so I'm not sure if there was an opening
Well,
question.
just tell us who you are and what your organization is
Okay.
about.
So I'm Kiana Lewis Arnold. I'm with the Aphia Center. I'm one of the full spectrum doulas, and I'm part of the birth justice team. If you're kind of familiar with the Aphia Center, we are a reproductive justice organization that do all of our work from a reproductive justice lens. And we are founded, by a Black woman. We work for our community, and yeah, so we're doing a lot of heavy policy work um, to make some change. Of course, with our our doula cohort, we've just trained about 13 new community doulas. The Aphia Center can now announce that we've purchased a building in South Dallas, and we are going to open a birth center in that area, a birth and wellness center to serve the South Dallas community. Um, the building actually should be ready in about 2 more weeks.
Oh, wow.
Do you
Congrats.
have midwives there?
Midwives are going to be able to use the space. Yes.
So it's like won't have its own midwives. It will be an open center.
Yes. Starting off, it will be an open center.
Thank you. Boy, you all have come a long way too in the time that I've known about your work. And then I see Walt and Isabel Davis have joined us. We can't see them. Let's see if they'll log on or let us see their video and hear them. I'll tell you a little bit about them while they're doing that. There they go. Hi, Walt. Hi, Izzy. We're just going around and saying who we are and why this is important for us to learn what Amy has to tell us. So do y'all want to do a quick intro and say where you live and why you're interested in maternal health? And I think you all ran into Beto at one of your meetings and he was interested. And so let me hear from you guys.
Hi.
Hi.
Isabel and I live near Commerce in East Texas. And our interest in this issue has stemmed from my relationship to Patty, my sister. And she has involved us in some very interesting meetings and discussions about this issue. And we're beginning to understand just how significant it is. And so we are here as observers, and thank you for the invitation.
Well,
I second what Walt said.
well, Izzy, I think you ought to be proud of being part of the East Dallas Persistent Women Project that we're doing the calling of centers
Oh, that's right.
on the directory for Healthy Texas Women when you found some flaws in that directory and who the actual providers were.
Right.
So that was before we even got involved in the email discussion and networking group. And Walt and I have done some training for the local Democratic group there in Commerce about maternal mortality. And there were some people who were seeking public office who were there, and they need information. They need a lot of information to know what the problems are so they can help be part of the solution. And that's a good segue into Amy. Amy's been a friend of this network of just folks loosely joined together through email. And she's an associate or assistant professor of pediatrics at the Texas College of Osteopathic Medicine. Her background is both social work and public health. She's done some community-based research and is focused on pregnancy, birth, and maternal health outcomes. So she's amply prepared to serve also on this Texas Morbidity and Mortality Review Committee. So I don't want to take any more time. You all know me. I'm Patty Hamilton, now retired artist. I've taken watercolor classes from my brother, who is an artist, but for me, that's my fun right now. So Amy, I would like to ask you to tell us what's going on with the review committee and what can we look forward to in the future?
Okay, sure. And what I'd like to do also is just do a brief overview of the process so that we kind of understand how it all works. And it just very, very quickly. I'm sorry?
Share my screen?
Yeah, I can, yes, that would be good. I can show you, I have a PowerPoint picture.
Get back to it. Okay, let's see.
I can also just go through it if it doesn't work.
Well,
Let's
I'm
see.
gonna
Oh,
post
okay, wait, see.
it.
Okay, so y'all should be able to see case preparation and review process. Is that what y'all see on your?
Yes.
Okay, so just to kind of give you an idea how it works, Department of State Health Services requests and processes records. They have their whole process before to even identify the records, which includes looking at, it's very extensive process of looking at death records, birth records, matching, looking at O codes, looking at pregnancy check boxes. So the epidemiology team goes through this process to identify the records or the cases in the first place. But then once they have those cases, they request the records from the providers, and not just providers, but investigative reports, any kind of records that could be found related to this case. Then they send it to us. So I serve on the committee, but I also have the contract that does all the redaction and abstraction and preparation for the review. So they send it to us and we redact all records because of a nursing policy in Texas. Texas is the only state that redacts records. So it's
Tell us what that means.
so we take off all provider information, all facility information. So when the review committee actually gets the records, they don't have any information about the mother. So you don't have her name or anything like that. You don't know where she delivered. You don't know what town she delivered in. You don't know what kind of providers, we know what kind of providers, but you don't know the names of the providers. And Texas is the only state that does that because of a nursing law that says if a nurse were to identify, I don't know the exact verbiage, but let me paraphrase. If they would identify something that's reportable, that they're required to report. Does that sound for the nurses? Does that make sense? So it's really to protect the nurses, because if you would read some of these cases, then they're absolutely reportable information. So Texas is the only state that does that. That's quite, we have students that work on that and redact all the records. And then that goes to mostly certified nurse midwives, but we have a few labor and delivery nurses and also a critical care nurse. So they abstract the records and they complete a case report. That information, we do several, and this is abbreviated process, but just so the big buckets here, we do several QA processes to make sure that the quality is there. We send our completed cases back to DSHS, and then we enter information in the CDC Maria database. Once it gets to DSHS, they do some QA, they prepare files for review in subcommittee, and they assign a lead reviewer. So then this information goes to smaller groups. The subcommittee provides some preliminary review via, Zoom, and then we complete draft forms. And then this information goes to the full review committee that meets quarterly. The lead reviewer presents a case, and then there's a full committee discussion. and we answer the key maternal mortality review committee questions. And then importantly, all this ends up in findings and recommendations that are compiled in a biennial report. And then the intent is to be disseminated to Texas legislature, key partners, stakeholders, and general public. So that's the process. Yes, Dinah?
Yes. So in preparation for this, and also for other reasons, I was listening to the recent the recent open meeting. I couldn't be there, but I listened to the video. And I also looked at the new CDC guidance for review committees, which suggests a much more involved process than this, because this is mostly based, if I'm understanding it right, and perhaps there's more to it that I haven't understood, but this is based mostly on the chart review. Maybe there's a number of charts, not just the hospital chart, the doctor's chart, maybe it's the social worker's charts, but you know, it's chart review. And there's a lot on the CDC website that talks about subpoenaing witnesses and also interviewing, and these seem to me vital as community involvement, which until recently has also been somewhat lacking. So I'm so excited that in this meeting, we have not only Brianna, but we also continue to have the involvement of AFIA. And I feel like, you know, if you listen, for instance, to Dr. Ortiz, she is the poor woman, you know, she represents the Black provider on that team. And she does stand up there and she says, let's all have a moment of silence. But the truth is that at the end of the day, statistics and analyses of charts, to me, as a community activist as well as a midwife, doesn't capture it, as I think our new community activist on the committee in the last meeting pointed out. You know, it's all about the stories which you get from the families of the people, the families of the women who died, and by literally talking in person to the people who were present.
Yeah, key informant interviews are missing from the Texas process. Yeah,
absolutely, and it's so vital.
Well, and so, well, yes, okay, so that's the process as it is today. But you're right. One of the things that is really rich in changes, there's just gaps. You can only get so much from the medical records or the investigative reports, or sometimes there's information in the autopsy or the medical examiner's report that's more qualitative in nature, but generally this is information that's gathered. So the importance of, well, okay, so that's a review committee. This is just the process really of the case preparation review process that I wanted to show that all this, it's a lot of preparation that goes into even getting the cases, and then there's a lot of preparation that goes into preparing the cases, and then there's a lot of work that goes into reviewing the cases, and a lot of work in making the report. So all that had been completed, but the report's not out. And so for those who had tuned into the open meeting component of it, so the commissioner came and talked to, and it was news to the review committee as well.
Oh,
the report.
wow.
It was not
really. That's amazing.
Wow.
So that's why, and I registered my disappointment. There's the review, the report is used for a lot of different reasons. Y'all have used it, you've read it, you have seen it in previous reports. We're already behind, although this would have been more contemporary cases. This would have been 2019 cases. which is part of the CDC grant that the Department of State Health Services received, required more contemporary. We had started in 2012 cases. So you can imagine 2012, sometimes you make recommendations based on what's the best thing, not whether they knew best practices back in 2012 or not. Does that make sense? Like you wouldn't say, well, we didn't have that evidence back then. It doesn't matter. You still make recommendations on what the best practices are today. But it would have been good to see what the 2019 data, looked like, so it could, the report serves as, many different purposes. But what's disappointing about the report not being published, one is you all know, I mean, I don't have to say that any day that goes by that information is not out there that could save a woman's life is time lost, right? So that's the most important reason. And then secondly, it informs stakeholders. Lakina talked about it very well about the need to have data for to be competitive in grants. And we're looking at grants ourselves here at the Health Science Center, and you need contemporary data for that. But then the third reason that I think is really interesting is that it serves as a resource for legislators, right? And so we don't have that this year. And so I think that's what the disappointment everyone was kind of describing, that a lot of work goes into this. It's important information, but yet it's not available in a timely fashion. And so I had asked in the review committee, what was the timeline, thinking it might be what had happened in the past during COVID, and we had to delay, and that was an addendum was published in December. And my understanding from the commissioner that they're looking at a timeline of next summer.
Yeah, and what I don't understand, I thought that the report was actually written by the committee itself, but it sounds like it's written by the commissioner and their staff.
No, it's written in combination by the committee and the Department of State Health Services.
So you've done your part, but they haven't done theirs. Is that correct?
Department of State Health Services, the report was ready.
Really?
Yes, so you've done your part and they haven't done theirs. The other thing that I have a question about is a lot, they blamed the redaction process. And it is very interesting that Texas is the only state that does that. But is it fair? You said you run the redaction process. Was it fair to blame the redaction process?
No, it's not. No. If it came across that the redaction is the reason that we couldn't get on, no.
I think the commissioner did blame the redaction. Were you there, Patty? I think you were.
I agree with you that it came across that way. Can Amy, could you stop sharing your screen so we can see?
Oh yeah, I'm sorry.
Because we've had a new person enter, Deandra's entered, but I don't see her there. So there's not even going to be an addendum. There's nothing coming out.
That's so of course, everything I know is from what the commissioner told at the
Sure.
Right. And so my understanding from him and from Dr. Hall is that there's the case ascertainment process has really improved over the years, which is a good thing because the data quality is getting better. But that means that even cases that were not first discovered through this process, when they've gone back and applied a different process, have been identified. So my understanding from her is that there's more cases that will be added to that cohort of 2019. And my understanding from the commissioner is that he felt that it would be confusing to the public to have different have data. Is that what y'all got out of the conversation? That
and he kept stressing comparison with other states, and I wasn't sure where that was coming from.
Yeah, we already do a different process, so there's already some issues with comparison with other states.
What is different about the process besides the redaction?
Well, some states may not have as robust epidemiology team to go through the cases and do a lot of the matching. Some may just use well, you have to with CDC grant funding to do up to 1 year. So they may just be using the pregnancy checkbox that was on the death certificate, or using O codes, which a lot of women that come across with that have died don't have O codes because they were like later on.
Would you let people know what a no
Would you?
code
You work lots with O codes. You let them know.
is? Okay, O codes are when a patient is diagnosed by provider, they're given a code for what their diagnosis category would be. And O, I assume, is obstetric. So there are a lot.
Oh, I see. The ICD. code.
Yes, I'm sorry.
I see.
ICD code.
9, 10, whatever
Yeah.
they're using, yeah,
Yeah.
right. Yes. Now, I see that Kiana Arnold has raised her hand. Let's see what she's got to say.
Oh, okay. So quick question. Definitely my concern with us not having the report. I'm really concerned about organizations like ours who need that kind of data for grants and funding, because that means now we don't have current data supporting what we already know stands to be true, about the maternal mortality rates, especially for Black women, since we primarily serve Black women at the FIA Center. My other concern is about the redaction process. We're still not getting real data, because some of the information that's removed during that process is really relevant when we talk about Black folks, Black birthing people specifically, having such high mortality rates, and us being able to narrow down, what spaces these things are happening at more often, if that makes sense. So it still feels like I'm glad I learned what the redaction process really meant today. I didn't really understand before, and I didn't understand on the call the other day. Because now it just leads me to feel like some of the data that we've been receiving, like there's still something missing, like with us being able to make the true connection with why specifically Black folk are weathering for worse. And I think some of that is in that data.
Yeah, that's an important point. One of the things that has been improved is knowing what kind of level hospital that she delivered at. Prior, we weren't able to know that. So that can be helpful as well. But that's why I think, going back to what Dinah was saying earlier, is this process is incomplete, because it's one-sided, really, if you think about it, because it's the medical right. part primarily, and you're missing the context. You're missing the context of now we do have information about the community, which has been very helpful, but there's missing information, and you're right. It's not that the data doesn't exist, but the way that the review committees, the review committees is one aspect of it. It's not the action oriented besides the report. It is more of the review, and it's not a punitive process. It's looking at trends, whereas like you have the perinatal collaborative, that's really the action oriented arm of the work, trying to get implemented, like the levels of care or the patient safety bundles, that kind of thing. But the process could be really, I've always thought that from the day one when I was on it, and it said it from the very first day, was that we need key informant interviews.
Yeah, I also, and just, I know this is, I don't know if it's off point. It doesn't seem to me to be off point, but it's sort of not exactly the process. But one of the things that I was very glad to see on the recent webcast that I just watched was the involvement and the great questions by the new community representative. I mean, there's one person, what a tremendous difference that one person is making. If only the mix of the committee were a little bit different. Maybe if you increased the number, you could get through more cases, and you could have more community advisors, just a bit of a better balance. So there wasn't just one spokesperson just responsible for the whole thing. And you would also end up with more representatives of the Black community. Because at the moment it's all on Dr. Ortiq and that one community advisor.
No, there's a couple more. The committee
Sorry.
changes that all the time. And so the committee right now is much more diverse than it's ever been. And part of the process, you know, I applied for this. I came across my, I don't know how I came across it in 2012. And I didn't feel like I was qualified for it, but I've always had an interest ever since. I've been involved in Amnesty International for years. So I've always been an interest in maternal mortality. And my chair at the time really, you know, said you should apply. And I was like, I don't qualify. There's much, you know, anyway, long story short, I applied and I was accepted. And here I am and showed my worth and was reappointed. But the point being, in the beginning, people didn't know about the committee. There's also some, and I think as it's grown in awareness, people are more interested in participating or now know about it. They didn't know about it before. So that's been a good thing that's helped change the dynamics of the review committee itself. Another thing that I think was brought up in the open meeting, I think by Dr. Ortiq, is the possibility, you know, for most of the review committee, it occurs outside of their normal work. You know, it's a lot, the reviewing the deaths is a lot of work. So they don't have time to just sit and devote a day to reviewing. So it's usually in the evenings or that kind of thing. And for some people, the cost of coming to Austin, although now we have it where we can do it remote, which has been a good thing for that, but still the in-person meetings are important. So someone had talked about, like, if there was a way to compensate, like not just, well, community activists, of course, for participating in the review committee would be a recommendation on how to make the committee itself stronger.
Well, I think I like, and didn't someone at the meeting bring up the point of expanding the number?
Yes, they did as well.
Yeah,
Yes.
right. I heard that.
Yeah.
But I want to also say that Amy was the first person on that committee who said how disappointed that she was, and I was clapping on my Zoom link. And I agree, it seemed like the mood or the context, and maybe that came from the surprise of the group that their report was not going to be released, but it seemed more assertive than maybe some in the past. Wow. I would love to know what went on in the closed meeting afterward, but I know you can't tell us that. But is there going to be pushback? Is there going to be something else happening?
Well, people are not happy, but one of the things that it's important to know, everyone on the committee is appointed by the commissioner. So it's an appointment, right?
Okay.
I'll leave it at that. But one of the things I really hope is that the open meeting component where public can comment, I would really like to see that more utilized. I would really like to see people, yeah.
Can I just comment on that?
Mm-hmm.
I don't know how we get out to the public and get more people, but I will tell you some experience that I've had on trying to be involved.
Okay.
Number one, the commissioner needs pushback from the committee itself to be told that the meetings are not up to date on the website, and it's been a problem for a long time. The open meetings are not identified individually. It just says there's a meeting. It doesn't tell you which ones are open and which ones are not. We came down all the way without realizing, we didn't even know that some of them are open and some of them are closed. And a whole group of us went all the way down to Austin, took time off. I made time for my work because I was working full time. We, worked very hard with presentations and who was presenting what and all of that. We go in, we're told it's closed, you're not allowed. Okay. And we spent money to travel. We spent money on hotels. It needs to be properly updated about what's happening there.
Yeah, Patty was just telling me that the last one available is in March. That's on the website.
Right.
I didn't know that.
Yeah, for people who want to know what's going on now. And the other thing is the 2013 project that was reported I can't find anything about that. Can you tell us what that was and where
You
we?
mean it in the, from the last, report?
Well, and then the last meeting there, and I don't have the name of the person who gave the report.
Oh, yeah, I requested that data myself. From Dr. Cook presented on the completion of the 2000, that was reported in the open meeting.
Yeah,
Yvonne?
yeah,
Yeah, no, I've asked for that myself, and I'll follow up on that and asking where we can expect, where can we get those slides? Where can we get that data?
right, yeah.
Yeah, so no, I as soon as the next Monday, I had asked for that data, but I haven't. I have a meeting today at 1:30, and I'll ask about that as well. And
Okay.
I'll report all these things that you're telling me too about, okay, so that there's, the open meetings aren't clearly, marked.
Well, even the link to how to get onto the stream is not, that should be a button on the page for the committee. You have to know how to navigate to find that.
It's
Uh,
very difficult.
I got it from you, but I'm not sure I would have found it otherwise.
Okay. When I even had to request it myself because I couldn't find it.
Oh, wow. All right,
So-
well, ditto then. I agree. That was very difficult.
Maybe this is this is a question you know about. How long does the commissioner remain the commissioner? How long has he got? It sounds like he's I don't know what. I don't want to. I mean, I don't know the guy. I'm yeah, that's my question.
I don't know, but I assume they go along, since they're appointed by the governor. I assume that they go along with their administration. I assume a new person would appoint a new commissioner. That's my assumption. Like, why usually people clear out and bring in their own people, right?
Sometimes I don't know.
Unless they're really good, then they keep them.
It's hard for me not to feel that, and I've heard people react about the fact they don't have the review report, that this has been a bad year for women's health. And it's a little off-putting to know that we also now don't have a report. And I think one of the people that Kiana, it might have been you, who wrote it, how disrespectful it is. Disrespectful for women not to
Right.
have this report, disrespectful for the review committee who weren't part of the decision to hold it back.
I think the community advocates used those words as well.
I did say that as well. That I felt
it was you too. Yeah,
it felt a little. It just felt a little disrespectful. I think that's what I said.
thought
It
maybe
feels
you-
disrespectful.
yeah.
I think it is very disrespectful. I think that's a
So
good word.
what now with the time we have, because I know you said you've got another meeting and we've got 20 minutes here. We've got some brains here and some feet on the ground in giving care. What can we do? What does the committee need to have the community rise up and make these recommendations more formally? I know that you're saying we should come and or do public comment.
Well, of course, that's just one avenue. The commissioner's always, I mean, he's there. You know what I'm saying? That's just one person, but there's, oh, sorry, I got distracted. There's communication doesn't have to be limited to just the open meetings. We're going into a legislative session, of course. And I think it's important to remember that the last 2-year report in 2020, it's not as if all those recommendations were implemented.
Yeah.
You know what I mean? So those recommendations, it's not as if they had finished those and now we're on to new recommendations and these are no, we still don't have comprehensive women's health care. We got 6 months. We didn't get the full year coverage of Medicaid extension. There's stuff on there that just hasn't been done. So I think, not to lose sight of the fact that we know where there's work to be done. The report, I mean, I feel the same as y'all do. I felt like it's very disappointing very disappointing and disrespectful, not to put out something.
Can the review committee put out something because they exist? I mean, you're how independent can you be from the commissioner? Can you put out a report and say, this is the committee's report, not under the separate, the commissioner is still working on stuff. This is our work that we can do up to now. You know what I mean?
Well, one of the things that I had suggested that we do for the next open meeting is in some states they have, I mean, this is report. It's not like you can't share data outside of your report, right? So one of the things that other states have done and Florida has done is have provided more they're called alerts. And so they're real-time data on things that are happening right now. I would like to see more of that, more contemporary. Like if you start seeing a trend happening, and then you can put out an alert on that, and that could, maybe go to the perinatal collaborative, go to stakeholders. So I think that we need to be open-minded about other ways to share information besides just the 2-year report. And we've talked about that, but everything that we talk about has to be in the open meeting. So we don't talk about, in the closed meetings, we only talk about the cases. Anything that we discuss about these ideas right now have to be in the open meeting.
But there's some caveat about if it's not on the agenda, you can't even talk about it in the open meeting.
Right.
I can come and testify, but you can't talk about it. So how do we get something on an agenda that can be talked about? Maybe.
And also the way it's set up, there's a presentation and there's no dialogue. At least sometimes there is a bit of a response. But, if the open meeting is the only format, the format maybe is not very flexible for our needs.
And that's why I think thinking beyond the committee, really, the committee is one arm. You've got the collaborative, but there needs to be more of an activism branch of it. Because even in the best scenario, a review committee can give really good data, key informant data, qualitative data, in addition to the quantitative, vital statistic type of data. But there's still, that's their scope. There's others groups that have a broader scope, like the perinatal collaborative, that is more of an implementation role. But a lot of, one of the things that, of course, the recommendations do, I'm going to go back to this point, is that it can guide legislation, right? And I think that maybe the public is going to have to be a little more not creative, but have to think, okay, well, these are the things that we want to see done regardless of a report, right? We know things.
Yeah.
We don't need a report for some things. Some things are very
Exactly.
specific, but some things we don't need a report on.
Yes.
Well, tell me some more about the perinatal collaborative and how we can, who's the contact person there to get the information to our group about what they're doing.
Yeah, I can send you, so I'll send you a link on the collaborative, but one of I'm sorry, I don't know the correct words. I don't know if they call him the president or the chair. I'm not sure the right word, but he's on the review committee, Pat Ramsey. He's really good, he's an MFM, really good guy. So he's has his had and role in both committees.
Well,
And
that's
so he's just recently taken on that position. But I can send you a link about that. They're always looking for people to join different committees that are working on different aspects. They're the ones that have been involved with the levels of care, like I was saying, and the patient safety bundles implementation, Texas AIM, and things like that. So it's important to remember that the review committee is one aspect, but there's other avenues. This is Department of State Health Services, but there's also the Human Health and Services Commission that deals with Medicaid. That's a whole nother department that deals with Medicaid, right? Going back to the 2020 recommendations, ones that haven't been implemented, talking to our legislators about things like access to contraception, with the work that y'all did with Healthy Texas Women, kind of getting more, I'd like more information about how well Texas Healthy Women, since the expansion of, auto enrollment after Medicaid has worked. There's just so much information that we need more information to be able to really pinpoint strategies.
Yeah.
I don't know, I'm kind of rambling. Is this kind of
I
what
think it's very useful rambling.
Yeah.
You say both, we need more information, which is obviously true because it's a mess, all the different groups and the stuff like that. And yet at the same time, you also say, you don't need a report to go and tell people what you think, which is also true because there's obviously, despite trends and despite changes in data, honestly, the ways forward are not going to be that much different, are they? I mean, it is what it is.
We haven't yet met baseline for other, for really good obstetric gynecological services in this state. We're not even at the beginning, at the door, much less want to make progress and go up a step. So yeah, I think you're right.
So what one of the things that I mentioned, I gave you in my intro all about, how I care about midwifery in the community and all of that, but I don't just care about it because I think, it's fun job, although it is. I really think that kind of care can save lives. And there's decent evidence that for low risk women, it is incredible common sense. There's a lot of evidence. And, like the Medicaid Center for Innovation and whatever it's called, that one, Amy, are you one of the, they've been promoting midwifery and community birth, but it's almost like nobody's actually listening. And there's good reason why nobody's listening. It's partly because, like Amy said, there's all these different organizations, but there's also because some of the people who are powerful or there are interests against that. And I feel, I just, what you're talking about is the overall frustration that we share. There are answers, not answers. I mean, it's not that easy, but there are ways forward that will make a huge difference that need to be funded, investigated, supported by the state. And what are our avenues? Like, I just, it says they're comparing states, but are we comparing states within the box, or are we looking outside the box at states that have really, I loved that New York report. It involved midwives so much. Are we doing any of that? Who chooses which states?
Well, yeah, I had a thought, but
yeah, Dinah, definitely what you're saying, like pushing, exploring, pushing support, having more community midwives, like funding the things that actually will make a difference. More community midwives, doulas being paid, pushing real Medicaid expansion, because this 6 months is not Medicaid expansion when we know folk need it for a full year. And it's hard to access. The folk that we've been helping and talking to people who are on the grounds, and the community midwives and the doulas are on the ground. Like, we're working with the folk. We're in the hospitals with folk having babies. We're in the homes having babies. We're in the birth centers having babies. And then we're catching these folks, and we're helping the folks who can no longer get abortions.
Right, and we're going to people's home afterwards, doing home care in the postpartum period that's so vital.
And we're helping them fill out their Medicaid paperwork because they can't sometimes.
Yeah.
And and talking of Medicaid paperwork, the whole Medicaid thing is such a vital part of this. There's a reason that I'm almost the only midwife providing community care on Medicaid. It's because it's a terrible process. It's an atrocious process. It's a disrespectful process. It's covered in barriers of time and hierarchy, in addition to the totally insufficient funds. You have to be out of your mind to take on Medicaid if you're a community midwife. And there's, I mean, who knows how to improve that? I've been to Austin to speak when one of the prices for paying facility payment came up. Oh, we don't decide that. I mean, it was just like so complicated.
Well, in these last few minutes, let's hear who you want to have me invite to another Zoom. Amy, do you have a suggestion? I tried to reach out to Nakinia, but the only place I found her was on LinkedIn, and I don't think.
Yeah, I saw her. I sent her an email actually.
I did too through LinkedIn, but I haven't heard anything. So is there a better way? Are you going to see her at 1:30?
Oh
no, this is just for the redaction or
Okay.
But I wanted, did y'all hear about, I'm afraid I didn't send it to this group. On Thursday night, we're showing the documentary Aftershock. I don't know if you've heard about it, but it's
amazing documentary.
Black maternal mortality. And we're having a panel, and Nakinia is going to be on our panel.
Who's we?
Where? How?
Who's we?
At the UNT, the Healthy Start is one of the programs I have here at the UNT Health Science Center. And so we're hosting it on Thursday night at 5:30 at on a medical school auditorium. And I can send you.
I'd love that. I've already seen it, but it's just like.
Well, I'll be traveling. Is it going to be something I can get later, or?
So you can, the movie itself or the documentary itself is on one of the Netflix or one of them.
Well, I'll find that, but what about
the panel discussion? I'll ask Misty if we can record it. Yeah, I can get permission.
Oh, that would be wonderful. Wonderful.
I think it'll be good. We have a midwife, Black midwife and a Black OBGYN, and then Nakinia, and then we have mental health professionals, just because it's a hard watch. So we have mental health professionals that will be there too, just if anyone needs that.
Okay. So
when is this meeting, and can I get, you're going to send out?
I'm going to send it, Patty, I'll send it to you, and then you can disseminate it. I apologize. We've got 153 people registered right now, so we're really excited. And the room, I think, holds 200 or something.
Wow. Well, I'll certainly send it on to everybody if you'll send me the information.
Okay, I'll send it right away.
Okay, who else do we need to invite to come to one of these Zooms? I want somebody from the Perinatal Collaborative. You think
Maybe,
Pat Ramsey would?
Maybe he would. He's a really nice guy, and he's really nice guy. Could I send an email to you and to him?
Yeah.
And to introduce you? And
please,
then,
yes. Okay. Yes. And I think the other thing is we've got to be politically active. That's where the pressure's got to come. Somebody is above the commissioner, pushing in whatever direction they think is best. And we need a different direction, I think. Walt and Izzy, is there a way that we could get this to Beto? You said that you had talked to him. I know Heidi has.
I can try. It's better to go through our county commissioner, our county chair.
Chair, okay.
For the Democratic Party.
Okay.
He has talked to him about this issue already, and I'll try.
I can invite someone from our policy team at the FIA Center to be on the next call, because we are in direct conversations with Beto. Like, we're already working.
All right.
We're a part of conversations and some upcoming events. So I'll make sure someone from our policy team is on the next call as well.
Okay.
What do you want from Beto?
Yeah,
you want somebody to attend a meeting of this group?
I think she said.
I would like to know what his platform is on maternal health and mortality in Texas. I'd like to know what is his thoughts on it. What is his plan to address it, particularly in the Black community?
Okay.
That's exactly the reason we are in conversation with them. We're doing the RJ rally, voters rally of I am a RJ voter. And so we're trying to schedule that for October the 15th. And for him, the invite is for him to come out and talk to the community on his plan as it relates to RJ issues here.
What date was that?
October 15th. So it's actually the grand opening of our Birth and Wellness Center in office. And we're wanting to do I'm a RJ voter rally that same day.
Oh, well, that's great.
And he's already agreed to come?
Not sure. I haven't updated with the person that's our policy folks that are working on that, but that's just like in our plan. And not just him, but another, other city officials, state officials, and all of that.
Well, that's what it's going to take. Can you send the information to me and let me send about your opening? Because that might be something that several of us would like to go.
Yes, that was the plan. We are working on it. We've been waiting on just city stuff to, how it is working with the city.
Yeah.
Which
We
city? Is
have an
it
older
Dallas
building, so
or?
you're gonna get the building up to code and fix. It is in Dallas, in the heart of Dallas.
Yeah, so it's in like Oak Cliff-ish or something like that?
Yeah.
Yes, in
South
Oak Cliff.
Mm-hmm.
Well, it's Hampton Liberty. I think that'd be like Southwest Dallas, Oak Cliff. It's real.
Okay, well, what we need to do, I'll try to get a hold of Pat Ramsey and see if he can come tell us about the collaborative. Walt and Isabel, this meeting's recorded. You can send this on to your county chair if that's of any benefit to you, so that I think some of the hearing it from people on the street who really know what they're talking about, like the providers here, I think is more powerful than numbers, actually. We've tried to approach some politicians with our numbers, and that doesn't go very far. So,
Patty?
yeah.
I have a question.
Yes.
What is an RJ voter?
Racial justice?
Reproductive justice.
Reproductive justice.
Oh, okay. Okay.
And there are other top tier candidates who may have responsibility in this area beyond the governor. I'll look into the job descriptions for the various others, like comptroller. We've heard her talk. She has connections of all sorts that I never heard of before, committees that she's on and so forth. So there may be more than one potential avenue.
Okay. We need to get the young Democrats in Tarrant County to go attend the aftershock.
Yeah.
We've got an in with those people.
I wonder, Kiana or Deandra, do y'all have something that's been created for policy as we go into the legislative session that's something that we could share, like as far as like a platform for maternal health? I know.
Yeah. I know. First of all, we have our State of Black Women report. We also have some other things. I can, if we're all in the email me exactly what you think you could use, and I'll make sure we get it from our policy team. Send it over.
Yeah, I was just thinking it might be very helpful. I know that when candidates will have their platform on what they're going to do about different things, but having something written down would be nice. I also wanted to remind y'all or let y'all know that there's been a blueprint coming out of the Biden administration on maternal mortality. And I don't know if y'all have had an opportunity to look at that report on the maternal health crisis. And it has a blueprint and strategies in there as well.
Okay. We'll look at that too. I hope a lot of our people who couldn't actually get away on a Monday to be here will watch this recording, because it certainly has built a fire under me to do some things that, besides just being downhearted about women's health in Texas. So I really appreciate the work that you've done. Amy, you've been one of our strongest supporters. Every time I've asked Amy to come share with us what's going on in the committee, she said yes. So that means a lot.
Thank you, Amy.
Yeah,
I'm happy
Thank
to.
you.
It's just a small little piece that I'm playing, but I hope to do what I can.
Just the fact that you all didn't know that that your work was not going to be passed on was unbelievable. I would never have known that if I hadn't heard you say it. So that tells us where we are and how hard we have to work to get to a better place. Well, folks, 102, Amy's got another meeting, and I know you all are busy and have lots to do as well. Thanks everybody for being here and caring as much as you do. And I will get with Pat Ramsey and see what we can do about something happening soon.
Yes, and thank you so much, everyone. Thank you.
Thank you. Thank you.
Bye.
Bye.
Bye.